Hi folks. In this video, I will tell you about polycystic ovary syndrome, one of the major causes of infertility globally. We will discuss the causes, symptoms, complications, treatment and diet good for PCOS patients. We will also briefly highlight the diet to be avoided by the PCOS sufferers. If you like my video, kindly press the subscribe button, share and comment. Polycystic ovary syndrome, PCOS, is a hormonal issue affecting reproductive years, resulting in irregular or prolonged periods and overproduction of androgen. It causes the development of cysts, filled with immature eggs called follicles, which fail to release eggs regularly. The exact cause of PCOS is unknown, but early diagnosis and treatment, along with weight loss, may reduce the risk of long-term complications like type 2 diabetes and heart disease. PCOS is a condition characterized by irregular ovulation, which is a condition where the body's ovaries produce high levels of androgen. This excess hormone interferes with ovulation, causing eggs to not develop regularly and not being released from the follicles where they develop. The exact cause of PCOS is unknown, but factors such as insulin resistance, low-grade inflammation, heredity, and excess androgen may play a role. Insulin resistance can lead to dark, velvety patches of skin, a larger appetite, and weight gain. Low-grade inflammation, a type of white blood cell response to infection or injury, is also a common symptom in PCOS patients. A family history of PCOS may also play a role in the development of the condition. Lastly, excessive androgen can result in hirsutism and acne. Overall, the exact cause of PCOS remains unknown. Many women with polycystic ovary syndrome have an imbalance in certain hormones, including testosterone, luteinizing hormone, LH, sex hormone binding globulin, and prolactin. These hormonal changes may occur in the ovary, other glands producing these hormones, or in the brain's control region. The exact cause of these hormonal imbalances is unknown, but it may start in the ovary, other glands producing these hormones, or in the brain's part controlling their production. Additionally, the changes may be caused by insulin resistance. The exact cause of these hormonal changes is not yet known. Polycystic disease symptoms typically begin during the first menstrual period but can develop later after periods have been absent. A diagnosis is made when at least two of the following symptoms are present: irregular periods, excessive androgen levels, and polycystic ovaries. Irregular periods, lasting longer than typical periods, and periods more than 35 days apart can be signs of polycystic ovary syndrome. High levels of androgen can lead to hirsutism, acne, and male pattern baldness. Polycystic ovaries may be larger and develop immature eggs around the ovary's edge, causing the ovaries to malfunction. Obesity is a risk factor for PCOS, as symptoms are more severe in those with obesity. Complications of polycystic ovary syndrome. PCOS can lead to various complications, such as infertility, gestational diabetes, miscarriage, non-alcoholic steatohepatitis, metabolic syndrome, type 2 diabetes, sleep apnea, depression, anxiety, and eating disorders, and endometrial cancer. Obesity is a common complication of PCOS, which can worsen its effects. Other potential complications include metabolic syndrome, high blood pressure, high blood sugar, unhealthy cholesterol, type 2 diabetes, sleep apnea, depression, anxiety, and eating disorders. Diagnosis of polycystic ovary syndrome. Your GP will assess your symptoms, blood pressure, and hormone tests to determine if excess hormone production is due to polycystic ovary disease or another hormone-related condition. An ultrasound scan may be necessary to detect polycystic ovaries, where eggs develop, and a blood test to measure hormone levels and screen for diabetes or high cholesterol. Other tests may include ultrasound scans and blood tests to screen for other potential causes. Diagnostic criteria for polycystic ovary syndrome. Polycystic ovary disease is diagnosed and other rare causes of the same symptoms are ruled out and at least two criteria are met: irregular or infrequent periods, high levels of male hormones like testosterone, and polycystic ovaries. These criteria can be met without the need for an ultrasound scan, as only 2 of them are required for diagnosis. The condition can be confirmed without the need for an ultrasound scan. Treatment of polycystic ovary syndrome. Lifestyle modifications. Weight loss can significantly improve symptoms and risk of long-term health problems from PCOS in overweight women. A 5% weight loss can significantly improve PCOS. To determine a healthy weight, calculate your BMI, which ranges from 18.5 to 24.9. Exercise regularly and maintain a balanced diet, including fruits, vegetables, whole foods, lean meats, fish, and chicken. Consult a dietitian for specific dietary advice if needed. A healthy weight can be determined by using the BMI Healthy Weight Calculator. A normal BMI is between 18.5 and 24.9. Medicinal treatment. For irregular or absent periods. Regular periods can be induced using a contraceptive pill or progestogen tablets, which can be given monthly or every 3 to 4 months. This helps reduce the risk of endometrial cancer, a womb lining cancer associated with not having regular periods. Other hormonal methods, like IUS, may not cause periods. For infertility. Clomiphene is a medication used to stimulate ovulation in women with PCOS, which can lower insulin and blood sugar levels. Metformin, often used to treat type 2 diabetes, can also lower cholesterol and heart disease risk. Metformin can cause side effects like nausea, vomiting, stomach pain, diarrhea, and loss of appetite. Letrozole, a medication used for treating breast cancer, is also used for fertility treatment. If oral medicines are ineffective, gonadotrophins, given by injection, may be recommended, but they may overstimulate ovaries and lead to multiple pregnancies. For unwanted hair growth or hirsutism. The combined oral contraceptive pill is used to treat excessive hair growth and alopecia. Eflornithine cream can slow down unwanted facial hair growth but is not always available on the NHS. Other treatments include plucking, shaving, threading, creams, or laser removal. Antiandrogens like cyproterone acetate, spironolactone, flutamide, and finasteride may be offered for excessive hair growth, but are not suitable for pregnant or trying to get pregnant individuals. For other issues. PCOS can be treated with weight loss medications like orlistat, cholesterol-lowering medications like statins, and acne treatments, depending on the individual's weight, cholesterol levels, and acne treatment needs. In vitro fertilization. If you have PCOS and don't get pregnant with medicines, you may be offered in vitro fertilization, IVF treatment. This involves collecting eggs from the ovaries and fertilizing them outside the womb, increasing the chances of having twins or triplets. Surgery for polycystic ovaries. Laparoscopic ovarian drilling, LOD, is a surgical procedure used to treat fertility issues related to PCOS. Under general anesthesia, a laparoscope is passed through the abdomen, destroying androgen-producing tissue. LOD lowers testosterone and LH levels, and raises FSH, restoring ovaries' normal function. Diet for polycystic ovary patients. Studies show diet significantly influences PCOS clinical presentation and laboratory findings. Polycystic ovary syndrome, PCOS, is a reproductive age medical condition characterized by hormonal and metabolic imbalances. Diet can improve symptoms and appearance. The PCOS diet includes low-glycemic fruits, vegetables, low-fat dairy, omega-3 fatty fish, lean red meat, poultry, legumes, and whole grain products. It can also help individuals lose weight and improve clinical and laboratory symptoms. What benefits can a PCOS diet provide? Research indicates that a PCOS diet can improve the clinical appearance of the syndrome, including weight loss, reduced body measurements, decreased insulin levels, free testosterone and glucose levels, and a decrease in hyperandrogenism, cholesterol, triglycerides, LDL, LH, FSH, hair loss, acne, and menstrual irregularities. The diet also improves the composition of inflammatory mediators and better ovaries imaging. Understanding the role of intestinal microbiota in PCOS pathogenesis is crucial, as the diet may act as a mediator between an individual's microbiota and their PCOS clinical and laboratory appearance. Foods best for PCOS patients. The PCOS diet consists of fruits, non-starchy vegetables, and low glycemic index vegetables, with a focus on unsaturated fatty acids. Low-fat dairy products are included, and proteins include leaner meats, fish rich in omega-3 fatty acids, lean red meat, and poultry. Almonds, pumpkin seeds, sunflower seeds, sesame seeds, legumes, whole grain products, and moderate amounts of alcohol are also included. The MED and DASH diets are associated with improving PCOS symptoms and ovaries imaging. The DASH diet reduces salt intake and focuses on heart-healthy foods, while the MED diet recommends low-processed and refined fats and high-healthy fats to reduce inflammation. Hydration and physical activity are also essential components of the PCOS diet. What foods to avoid in PCOS? PCOS patients should limit sugar and saturated fats to prevent hypertension and cardiovascular disease. High-sodium diets can worsen insulin resistance. Avoid fried foods, processed meats, refined carbohydrates, and processed snacks to follow the PCOS diet. Sugar content in processed snacks can worsen insulin resistance. Pregnancy risks in PCOS. Polycystic ovary syndrome increases pregnancy complications like hypertension, preeclampsia, gestational diabetes, and miscarriage, especially in obese individuals. Losing weight before trying for a baby can lower these risks, especially if the individual is overweight or obese. This channel is only intended to guide about the health benefits of different fruits, vegetables, nuts, various diets, etc. so that these can be adopted in our healthy lifestyle, can help in avoidance or delaying medication for various diseases. This information is no substitute for medical advice. Always consult with your doctor, dietitian, or nutritionist for the final word. Together, we can make a difference. Please watch, like, comment and share this video. Kindly subscribe my channel and hit the bell icon.